So before we had My Health Direct, we were like many practices in that we were trying our best to ensure that all the referrals we sent out for our patients were being scheduled, were being attended by the patients, and that we also got follow-up back from the consultants. It was a piecemeal process.
Before we started using the system, the referral coordinators had to spend a lot of time on the phones waiting for the specialist office to answer.
And now with My Health Direct, since it can be done directly online, even with the patient on the phone, we can even see what times are available for the patient and the times that are convenient for the patient.
It's changed for me because since I'm a referral coordinator, we used to spend at least 15 minutes sometimes on hold when the other offices used to have patients in front of them. They used to put us on hold. But now with this system, when the patient comes, as soon as they're done seeing the doctor, we can get them right away with appointments, the confirmation the day before, and everything.
There's no waiting for a patient. It's done right away. Patient gets up, walks, goes with the referrals in his hand, goes with the appointment in his hand. Next person come in, is done over and over and over again. So what that means is our referral specialist can maybe do 8 or 10 patients in 1 hour, where before she was doing 1 or 2.
This is the great example of work that put the patient first and foremost. The result being that patients had a better experience. They had decreased time before they went to see their specialist. But at the same time, there's great benefit back to the plan in terms of reduced hospitalizations, reduced ER visits, and great feedback back to the primary care physicians.
The open table for restaurants, right? But in this case for physician offices, they could just click on availability and we could provide a venue where our preferred specialists can house faster visits, faster meaning more immediate visits. We knew that that would be a huge service, not just for our patients, but also for our own primary care physicians to get the care that the patient needed faster.
You know, the real-time analytics is a very good tool for our team because we're able to monitor the utilization of that tool, so we can actually see how often a referral clerk logs into the system, and this allows us to increase efficiencies and productivity as well within that department.
I receive all the time calls from the clinics. I need an appointment, stat, and I can because I didn't have enough time. Now it's the best option.
It's a time saver. It reminds the patients of their appointments, so we can reduce the no-show ratio. And the patients leave with their appointment date and time on their hands when they come to the doctor's office. I think it's great.
My vision for the growth of the program would be to have My Health Direct participating in all our major markets throughout the state of Florida and beyond.
I would say that this is a tool in an emerging science, and it is, to me, an emerging best practice.